NCLEX RN Test 1 for 2026. Question 1. The nurse is caring for the client who has been in a coma for 2 months. He has signed a donor card, but the wife is opposed to the idea of organ donation. How should the nurse handle the topic of organ donation with the wife? Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Tell her that because her husband signed a donor card, the hospital has the right to take the organs upon the death of her husband. Explain that it is necessary for her to donate her husband's organs because he signed the permit. Refrain from talking about the subject until after the death of her husband. Question 2. Due to a high census, it has been necessary for a number of clients to be transferred to other units within the hospital. Which client should be transferred to the postpartum unit? A 66-year-old female with gastroenteritis, a 40-year-old female with a hysterectomy, a 27-year-old male with severe depression, a 28-year-old male with ulcerative colitis. Question 3. Before administering theophylline, the nurse should check the patient's output, blood pressure, pulse, temperature. Question 4. Which information should be given to the patient undergoing radiation therapy for breast cancer? Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Moisturize the radiation site with oil-based lotion to prevent blistering. Use bath oil when tub bathing to prevent drying and peeling. Report redness and soreness of the area to the physician. Question 5. The charge nurse is making assignments for the day. After accepting the assignment to care for a client with leukemia, the nurse tells the charge nurse that her child has chickenpox. Which initial action should the charge nurse take? Change the nurse's assignment to another client. Explain to the nurse that there is no risk to the client. Ask the nurse if the chickenpox have crusted. Ask the nurse if she has ever had the chickenpox. Question 6. Which statement is true regarding therapy with levemir, insulin detemir? The onset is 1 to 2 hours. It may be mixed with regular insulin. It peaks in 2 to 3 hours. The duration is 24 hours. Question 7. Which client should be assigned to the nursing assistant? The 18-year-old with a fracture to 2 cervical vertebrae. The infant with meningitis with a temperature of 101 degrees Fahrenheit. The elderly client with a thyroidectomy 4 days ago. The client with a thoracotomy 2 days ago. Question 8. The physician has ordered the Schilling test for a patient with suspected pernicious anemia. What other vitamin level is often assessed at the same time as the B12 level? Folic acid, pyridoxine, ascorbic acid, thiamine. Question 9. The client is admitted to the emergency room with shortness of breath, anxiety, and tachycardia. His ECG reveals atrial fibrillation with a ventricular response rate of 130 beats per minute. The doctor orders quinidine sulfate. While he is receiving quinidine, the nurse should monitor his ECG for Bryant's traction, ice to the entire extremity, Buck's traction, an abduction pillow. Quinidine can cause widened QT intervals and heart block. Question 10. Which statement should be included in the teaching session of a client scheduled for a renal biopsy? You will be placed in a sitting position for the biopsy. You may experience a feeling of pressure or discomfort during aspiration of the biopsy. You will be asleep during the procedure. You will not be able to drink fluids for 24 hours following the study. Question 11. The client is admitted with chronic obstructive pulmonary disease. Blood gases reveal pH 7.36, Co 245, O2 84, bicarb 28. The nurse would assess the client to be in uncompensated acidosis, compensated alkalosis, compensated metabolic acidosis, uncompensated metabolic acidosis. Question 12. Before administering intravenous chemotherapy to the patient being treated, the nurse should administer a bolus of 4 fluid, administer pain medication, administer an antiemetic, allow the patient a chance to eat. Question 13. Which one of the following statements is correct when measuring the client for crutches? G6PD deficiency, beta thalassemia, sickle cell anemia, von Willebrand disease. Question 14. The physician has ordered Coumadin, sodium warfarin, for a client with thrombophlebitis. The order should be entered to administer the medication at 0900, 1200, 1700, 2100. Question 15. Which medication is often used to treat the client with gonorrhea? Cetavig, acyclovir, vibromycin, doxycycline, retrovir, zidovudine, Aldura, imiquimod. Question 16. The nurse is caring for a client with cerebral palsy. The nurse should provide frequent rest periods because grimacing and writhing movements decrease with relaxation and rest. Hypoactive deep tendon reflexes become more active with rest. Stretch reflexes are increased with rest. Fine motor movements are improved by rest. Question 17. The nurse is assisting in the care of a patient who is 2 days post-operative from a hemorrhoidectomy. The nurse would be correct in instructing the patient to a WBC of 14,000 cu.mm, auscultation of abdominal brute, complaints of lower back pain, a platelet count of 175,000 cu.mm. Question 18. The nurse is performing an assessment on a client with possible pernicious anemia. Which finding is specific to pernicious anemia? A weight loss of 10 pounds in 6 months, fatigue, glossitis, pallor. Question 19. The nurse is making assignments for the day. The staff consists of an RN, an LPN, and a nursing assistant. Which client could the nursing assistant care for? A client with Alzheimer's disease, a client with pneumonia, a client with cirrhosis, a client with thrombophlebitis. Question 20. The client is diagnosed with multiple myeloma. The doctor has ordered cyclophosphamide, cytozan. Which instruction should be given to the client? Walk about a mile a day to prevent calcium loss. Increase the fiber in your diet. Report nausea to the doctor immediately. Drink at least 8 large glasses of water a day. Question 21. While caring for an elderly patient with hypertension, the nurse notes the following vital signs: BP of 140/40, pulse 120, respirations 36. The nurse's initial action should be to report the findings to the physician, recheck the vital signs in 1 hour, ask the patient if he is in pain, compare the current vital signs with those on admission. Question 22. The charge nurse overhears the patient care assistant speaking harshly to the client with dementia. The charge nurse should change the nursing assistant's assignment, explore the interaction with the nursing assistant, discuss the matter with the client's family, initiate a group session with the nursing assistant. Question 23. Which action by the home health nurse indicates a knowledge of the needs of an elderly client? Client with glomerulonephritis is placed on a low-sodium diet. Which of the following snacks is suitable for the client with sodium restriction? Speaking in a higher-pitched voice tone to facilitate hearing, encouraging fluid restriction to prevent nighttime voiding, reinforcing teaching regarding the prevention of falls. Peanut butter cookies, grilled cheese sandwich, cottage cheese and fruit, fresh peach. Question 24. The nurse can help alleviate the discomfort the client is experiencing associated with xerostomia by limiting fluid intake, administering an analgesic, splinting swollen joints, providing sugarless hard candy. Question 25. The client returns to the recovery room following repair of an abdominal aneurysm. Which finding would require further investigation? Pedal pulses regular, urinary output 20 ml in the past hour, blood pressure 108/50, oxygen saturation 97%. Question 26. The nurse has an order for the administration of intravenous heparin. The medication should be administered using a/N. Patient is diagnosed with secondary syphilis. The nurse can expect the patient to have infusion controller, intravenous filter, three-way stopcock, copper penny rash on the palms of the hands and soles of the feet, localized tumors in the skin, bones, and liver, Chong cress and lymphadenopathy, general paresis, copper penny rash on the palms of the hands and soles of the feet. Question 27. The nurse is aware that a common mode of transmission of Clostridium difficile is use of unsterile surgical equipment, contamination of objects with sputum, through urinary catheterization, contamination of objects with stool. Question 28. The nurse is assessing the abdomen. The nurse knows the best sequence to perform the assessment is: the client is observed shaving only one side of his face. Auscultation, palpation, inspection, palpation, inspection, auscultation, inspection, palpation, auscultation. Making sure the vital signs are recorded, obtaining a signed permit for surgery, explaining the surgical procedure, answering questions about the surgery. The client is observed shaving only one side of his face. The client is unable to complete a range of vision without turning his head side to side. The client is unable to carry out cognitive and motor activity at the same time. Question 29. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated from this client's diet? Roasted chicken, noodles, cooked broccoli, custard. Question 30. The doctor orders 2% nitroglycerin ointment in a 1-inch dose every 12 hours. Proper application of nitroglycerin ointment includes rotating application sites, limiting applications to the chest, rubbing it into the skin, covering it with a gauze dressing. Question 31. The client has an order for thiazole, ferrous sulfate. To promote absorption, the nurse should administer the medication with meal, orange juice, orange juice. Question 32. Which information should be given to the client using a TENS unit? Electrocution may occur if you use water with this unit. Skin irritation may occur with prolonged use of the unit. The unit can be placed anywhere on the body without fear of adverse reactions. A cream or lotion should be applied to the skin before applying the unit. Question 33. The nurse is making initial rounds on a client with a C5 fracture stabilized by Crutchfield tongs. Which equipment should be kept at the bedside? Forceps, torque wrench, wire cutters, screwdriver. Question 34. The client with diabetes is preparing for discharge. During discharge teaching, the nurse assesses the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? I live by myself. I have trouble seeing. I have a cat in the house with me. I usually drive myself to the doctor. Question 35. Which of the following post-operative diets is appropriate for the client who has had a hemorrhoidectomy? High fiber, lactose-free, bland, clear liquid. Question 36. The nurse is assessing the vital signs of a client with pancreatic cancer. In addition to routine vital signs, the nurse assesses the fifth vital sign of client with diabetic ulcers to the left foot, pain, laryngectomy for laryngeal cancer, fatigue. Question 37. The nurse is removing a peripherally inserted central catheter, PIC. The nurse should position the patient in which position? Fowler's, right side lying, left side lying, Trendelenburg. Question 38. The nurse is assigning staff for the day. Which client should be assigned to the nursing assistant? 1-year-old with a fractured tibia, a 10-year-old who is 2-day post-appendectomy. Question 39. Which of the following is a late sign associated with oral cancer? Client with an ileostomy is being discharged. Which teaching should be included in the plan of care? Odor, using stomadhesive as a skin protector, ulcer with flat edges. Using Carrea powder to seal the bag, irrigating the ileostomy daily, Using stomadhesive as a skin protector, using a stool softener as needed. Question 40. The nurse discovers a patient care assistant looking through the client's belongings while the client is out of the room. Which action should be taken by the nurse? Discuss the nursing assistant's behavior with the family. Report the incident to the charge nurse. Monitor the situation and note whether any items are missing. Ignore the situation until items are reported missing. Question 41. The physician has prescribed Zyvox, linezolid, for a patient with VRE. The concurrent use of which of medication may result in serotonin syndrome? Nexium, esomeprazole, Zoloft, sertraline, Lipitor, atorvastatin, Zyrtec, ketorisen. Question 42. The doctor has ordered antithrombotic stockings to be applied to the legs of a client with peripheral vascular disease. The nurse knows antithrombotic stockings should be applied before the client arises in the morning, with the client in a standing position, after the client has bathed and applied lotion to the legs, before the client retires in the evening. Question 43. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? The client with Cushing's disease, the client with diabetes, the client with acromegaly, the client with myxedema. Question 44. The physician has ordered atropine sulfate 0.4 mg IM before surgery. The medication is supplied in 0.8 mg per milliliter. How much medication should the nurse prepare to administer? Allergies to shellfish or iodine allergies: 0.5 ml, 1.0 ml, 1.25 ml. Allergies to shellfish or iodine allergies: the ability to lie prone for 30 minutes, the presence of body tattoos. Question 45. Which statement made by the student nurse indicates the need for further teaching regarding the administration of heparin? I will need to gently aspirate when I give the heparin. I will not massage the injection site after administering the heparin. I will check the PTT before administering the heparin. I will need to gently aspirate when I give the heparin. Question 46. The nurse is caring for a client with beta thalassemia major. Which therapy is used to treat beta thalassemia major? 4 fluids, frequent blood transfusions, oxygen therapy, iron therapy. Question 47. The client with a recent liver transplant asks the nurse how long he will have to take an immunosuppressant. Which response is correct? 1 year, 5 years, 10 years, life. Question 48. The nurse is caring for a patient following a thyroidectomy. Which of the following is an early symptom of hypocalcemia? Positive Quast-X sign, 3+ deep tendon reflexes, numbness or tingling of the toes and extremities, prolonged ST and QT intervals. Question 49. Which of the following is the best indication of resolution of a paralytic ileus? Passage of stool, eructation, presence of bowel sounds, decreasing abdominal girth. Question 50. The nurse is caring for a client with a diagnosis of cirrhosis who is experiencing pruritus. Which of the following is an appropriate nursing intervention? Suggesting that the client take warm showers twice daily, applying a lotion containing menthol or camphor to the skin after bathing, applying powder to the client's skin, placing warm compresses on the affected areas. Question 51. The nurse is caring for a client with a recent laparoscopic hemicolectomy. Which findings should be reported to the physician? Sluggish bowel sounds, pain and tenderness at the umbilicus, passage of small amount of liquid stool, increasing abdominal girth. Question 52. The client presents to the emergency room with a hyphema. Which action by the nurse would be appropriate? Elevate the head of the bed and apply ice to the eye. Place the client in a supine position and apply heat to the knee. Insert a Foley catheter and measure the intake and output. Perform a vaginal exam and check for a discharge. Question 53. The patient is prescribed metronidazole, Flagyl, for adjunct treatment for a duodenal ulcer. When teaching about this medication, the nurse would include, this medication should be taken only until you begin to feel better. This medication should be taken on an empty stomach to increase absorption. While taking this medication, you do not have to be concerned about being in the sun. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Question 54. The nurse is evaluating the client's pulmonary artery pressure, PAP. The nurse is aware that PAP evaluates. A low-protein diet helps reduce blood urea nitrogen and other wastes excreted by the kidneys. Systolic, diastolic, and mean pressure in the pulmonary artery. Pressure in the pulmonary veins. Pressure in the right ventricle. When assessing the client's blood pressure, the nurse should use a cuff with a width that is ____% of the circumference of the extremity. Fill in the blank. 40-30-2010. Question 55. Before administering eye drops, the nurse should recognize that it is essential to consider which of the following. Client with cirrhosis is receiving Cefulac, lactulose. The nurse is aware that Cefulac is given to lower. The patient will be more comfortable if allowed to instill his own eye drops. Ammonia. Eye drops should always be warmed before instilling in the patient's eyes. Blood glucose, uric acid, ammonia, creatinine. Question 56. The physician prescribes captopril, Capoten, 25 mg per bid for the client with hypertension. Which of the following adverse reactions can occur with administration of Capoten? Tinnitus, persistent cough, muscle weakness, diarrhea. Question 57. The home health nurse is planning for the day's visits. Which client should be seen first? The client with renal insufficiency, the client with Alzheimer's disease, the client with diabetes who has a decubitus ulcer, the client with multiple sclerosis who is being treated with 4-cortisone. Question 58. In planning care for the patient with ulcerative colitis, the nurse identifies which nursing diagnosis as a priority. Fraud, impaired skin integrity, fluid volume deficit, nutrition altered, less than body requirements. Fraud, tort, malpractice, negligence. Question 59. Which complaint is frequently expressed by a client with macular degeneration? Problems with activities requiring focused vision such as sewing, severe eye and face pain accompanied by nausea and vomiting, seeing halos around lights, veil-like loss of vision. Question 60. When assessing deep tendon reflexes, the nurse grades the client's patellar reflex as a 3+. This reading indicates that the assessed reflex is hypothyroidism, hypoactive, hyperactive hypothyroidism, diabetic ulcers, gastroenteritis, bacterial pneumonia. Question 61. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include BP 68/34, pulse rate 130, and respirations 18. Which is the client's most appropriate priority nursing diagnosis? Alteration in cerebral tissue perfusion, fluid volume deficit, ineffective airway clearance, alteration in sensory perception. Question 62. The nurse identifies ventricular tachycardia on the cardiac monitor. The patient has a pulse rate of 160 with a regular rhythm. The nurse should give priority to administering atropine sulfate, requesting a stat potassium level, administering amiodarone, defibrillating at 360 joules. Question 63. The nurse is discharging a client with a prescription of eye drops. Which observation by the nurse would indicate a need for further client teaching? Shaking of the suspension to mix the medication, administering a second eye drop medication immediately after the first one was instilled, washing the hands before and after the administration of the drops, holding the lower lid down without pressing the eyeball to instill the drops. Question 64. The physician has prescribed Novolog, as part, insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the onset of the insulin occurs? I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Question 65. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is measuring the urinary output, checking the vital signs, encouraging increased fluid intake, weighing the client. Question 66. The nurse is providing dietary teaching for a client with elevated cholesterol levels. Which cooking oil is not suggested for the client on a low cholesterol diet? Safflower oil, sunflower oil, coconut oil, canola oil. Question 67. The nurse is teaching a client with peritoneal dialysis how to manage exchanges at home. The nurse should tell the client to notify the doctor immediately if the dialysate returns become cloudy in appearance. The return of the dialysate is slower than usual. Question 68. The nurse is caring for a client with diabetes mellitus. Which instruction should be given to the client? Decreased blood pressure and constricted pupils. Tell the client to decrease her intake of sodium. Instruct the client to weigh daily. Tell the client to report numbness and tingling in her feet and toes. Decreased blood pressure and constricted pupils, increased heart rate and increased respirations and increased blood pressure, anoxia and absence of the cough reflex. Question 69. The nurse caring for a client with a head injury would recognize which assessment finding as the most indicative of increased ICP? Vomiting, headache, dizziness, papilledema. Question 70. On the second postoperative day after a subtotal thyroidectomy, the client tells the nurse, "I feel numbness and my face is twitching." What is the nurse's best initial action? Offer mouth care, loosen the neck dressing, notify the physician, document the finding as the only action. Question 71. Which statement is true regarding a patient with a Sengstaken-Blakemore tube? The smaller balloon will provide direct pressure to control bleeding from the esophagus. The tube has 4 lumens, one of which drains esophageal secretions. The esophageal balloon should be inflated to a pressure between 30 to 35 mmHg. Scissors should be kept at the patient's bedside. Question 72. The nurse is assessing a trauma client in the emergency room when she notes a penetrating abdominal wound with exposed viscera. The nurse should apply a clean dressing to protect the wound, cover the exposed viscera with a sterile saline gauze, gently replace the abdominal contents, cover the area with a petroleum gauze. Question 73. Which medication should be avoided by the client with acute pancreatitis? Demerol, meperidine, Pepcid, famotidine, Zantac, ranitidine, Duramorph, morphine sulfate. Question 74. The nurse is changing the ties of the client with a tracheostomy. The safest method of changing the tracheostomy ties is to client having a colonoscopy is medicated with Versed, midazolam. The nurse recognizes that the client have a helper present in case assistance is needed. Hold the tracheostomy tie with the non-dominant hand while removing the old tie. Flush the ing tube with 2 to 4 ounces of water before and after giving the medication. Flush the ing tube with 2-4 ml of water before giving the medication. Administer the medication, flush with 5 ml of water, and clamp the ing tube. Flush the ing tube with 5 ml of normal saline and administer the medication. Flush the ing tube with 2 to 4 ounces of water before and after giving the medication. Will be able to remember the procedure within 2 to 3 hours. Will not be able to remember having the procedure done. Will be able to remember the procedure within 2 to 3 days. Will not be able to remember what occurred before the procedure. Will not be able to remember having the procedure done. Question 75. The nurse is planning care for a client with adrenal insufficiency. The nurse should give priority to monitoring the client for signs of dehydration, promoting sleep and rest, providing high-calorie snacks, promoting a healthy body image. Question 76. The nurse is assessing a client who had a colon resection 2 days ago. The client states, "I feel like my stitches have burst loose." Upon further assessment, dehiscence of the wound is noted. Which action should the nurse take? Immediately place the client in the prone position. Apply a sterile, saline moistened dressing to the wound. Administer atropine to decrease abdominal secretions. Wrap the abdomen with an ACE bandage. Question 77. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? Application of a walking boot. Stabilization with a cast. Surgery with Kirschner wire implantation. Application of spica cast. Question 78. The nurse is preparing a client with gastroesophageal reflux disease, GERD, for discharge. The nurse should tell the client to eat a small snack before bedtime, sleep on his right side, avoid carbonated beverages, increase his intake of citrus fruits. Question 79. The nurse is performing discharge teaching on a client with ulcerative colitis who has been placed on a low-residue diet. Which food would need to be eliminated from this client's diet? Roasted chicken, noodles, cooked broccoli, roast beef. Question 80. While caring for a client with cervical cancer, the nurse notes that the radioactive implant is lying in the bed. The nurse should. The client no longer has intractable tremors. Give the client a pair of gloves and ask her to reinsert the implant. Use tongs to pick up the implant and return it to a lead-lined container. Discard the implant in the commode and double flush. The client no longer has intractable tremors. The client has sufficient production of dopamine. The client no longer requires any medication. The client will have increased production of serotonin. Question 81. The physician has ordered a homocysteine blood level on a client. The nurse recognizes that the results will be increased in a client with a deficiency in which of the following? Vitamin B12, vitamin C, vitamin A, vitamin E. Question 82. Which obstetrical client is most likely to have an infant with respiratory distress syndrome? Client with AC4 spinal cord injury has been placed in traction with cervical tongs. Nursing care should include a 24-year-old with a history of diabetes mellitus, releasing the traction for 5 minutes each shift, performing sterile pin care as ordered, elevating the head of the bed 90 degrees, performing sterile pin care as ordered. Question 83. The nurse has been teaching the role of diet in regulating blood pressure to a client with hypertension. Which meal selection indicates the client understands his new diet? Cornflakes, whole milk, banana, and coffee. Scrambled eggs, bacon, toast, and coffee. Oatmeal, apple juice, dry toast, and coffee. Pancakes, ham, tomato juice, and coffee. Question 84. The nurse is caring for a child in a plaster of Paris hip spica cast. To facilitate drying, the nurse should. Client is admitted with kidney disease. Which type of intravenous fluid is likely to be ordered for this client? Isotonic. Turn the child at least every 2 hours. Allow one side to dry before changing positions. Hypertonic, isotonic, colloid, hypotonic. Question 85. Which of the following statements is true regarding management of the client with multiple sclerosis? Schedule of strenuous exercise will improve muscle strength. Rest periods should be scheduled throughout the day. Rest periods should be scheduled throughout the day. Question 86. The nurse is preparing to administer regular insulin by continuous 4 infusion to a client with diabetic ketoacidosis. The nurse should mix the insulin with dextrose 5% in water. Flush the 4 tubing with the insulin solution and discard the first 50 ml. Avoid using a pump or controller with the infusion. Mix the insulin with Ringer's lactate. Question 87. The nurse is caring for a client with possible cervical cancer. What clinical data would the nurse most likely find in the client's history? Postcoital vaginal bleeding, nausea and vomiting, foul-smelling vaginal discharge, elevated temperature levels. Question 88. The nurse is caring for a client with amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease. The nurse should give priority to assessing the client's respiratory status, providing an alternate means of communication, referring the client and family to community support groups, instituting a routine of active range of motion exercises. Question 89. The physician has prescribed nitroglycerin sublingual tablets as needed for a client with angina. The nurse should tell the client to take the medication. Client is admitted to the emergency department with a loss of consciousness with unknown etiology. The nurse expects to perform which laboratory test to assist in determining etiology. Every 4 hours to prevent chest pain. Serum glucose. At bedtime to prevent nocturnal angina. Total cholesterol alkaline phosphatase serum glucose urinalysis. Question 90. The home health nurse is visiting a 30-year-old with sickle cell disease. Assessment findings include splenomegaly. What information obtained on the visit would cause the most concern? The client eats fast food daily for lunch, drinks a beer occasionally, sometimes feels fatigued, works as a furniture mover. Question 91. The nurse is caring for a client with a head injury who has an intracranial pressure monitor in place. Assessment reveals an ICP reading of 66. What is the nurse's best action? Notify the physician. Record the reading as the only action. Turn the client and recheck the reading. Place the client supine. Question 92. The nurse is completing the preoperative checklist on a client scheduled for surgery and finds that the consent form has been signed, but the client is unclear about the surgery and possible complications. Which is the most appropriate action? Call the surgeon and ask him to come see the client to clarify the information. Explain the procedure and complications to the client. Check in the physician's progress notes to see if understanding has been documented. Check with the client's family to see if they understand the procedure fully. Question 93. 4 clients are to receive medication. Which client should receive medication first? Increased urinary output. The nurse is planning the diet of a client who is recovering from acute pancreatitis. The nurse should select foods that are a client with labored respirations receiving a stat dose of 4 Lasix, furosemide, low in fat and low protein. Low in sodium but high fat, high in protein and sodium, low in fat and low protein, increased urinary output, stabilized weight, improved appetite, increased pedal edema. Question 94. The physician has ordered 2 units of whole blood for a client following surgery. To provide for client safety, the nurse should obtain a signed permit for each unit of blood, use a new administration set for each unit transfused, administer the blood using AY connector, check the blood type and RH factor 3 times before initiating the transfusion. Question 95. During the change of shift report, a nurse writes in her notes that she suspects illegal drug use by a client assigned to her care. During the shift, the notes are found by the client's daughter. The nurse could be sued for libel, slander, malpractice, negligence. Question 96. The registered nurse is making shift assignments. Which client should be assigned to the licensed practical nurse, LPN? Decreased blood pressure, moist mucous membranes, decreased respirations, increased blood pressure. Question 97. The nurse knows that a client with right-sided hemiplegia understands teaching regarding ambulation with a cane if she states, "I will hold the cane in my right hand. I will advance my cane in my right leg at the same time. I will be able to walk only by using a walker. I will hold the cane in my left hand." Question 98. The nurse is conducting a physical assessment on a client with mild anemia. Which of the following would the nurse expect to observe? Client with angina is experiencing migraine headaches. The physician has prescribed sumatriptan succinate, Imitrex. Which nursing action is most appropriate? Increased respiratory rate, activity intolerance, Frequent respiratory infections. Call the physician to question the prescription order. Try to obtain samples for the client to take home. Perform discharge teaching regarding this drug. Consult social services for financial assistance with obtaining the drug. Call the physician to question the prescription order. Question 99. The nurse is assessing a client hospitalized with a duodenal ulcer. Which findings should be reported to the doctor immediately? BP 82/60, pulse 120, pulse 68, respirations 24, BP 110/88, pulse 56, pulse 82, respirations 16. Question 100. Which statement made by the family member caring for the client with a percutaneous gastrostomy tube indicates understanding of the nurse's teaching? I must flush the tube with water after feedings and clamp the tube. I must check placement 4 times per day. I will report to the doctor any signs of indigestion. If my father is unable to swallow, I will discontinue the feeding and call the clinic. Question 101. The nurse is caring for a client following the reimplantation of the thumb and index finger. Which findings should be reported to the physician immediately? Temperature of 100 degrees Fahrenheit. Coolness and discoloration of the digits. Complaints of pain. Difficulty moving the digits. Question 102. The nurse is caring for a client with full-thickness burns to the lower half of the torso and lower extremities. During the emergent phase of injury, the primary nursing diagnosis would focus on: check the lab work, risk for infection related to altered skin integrity, risk for fluid volume imbalance related to intracompartmental fluid shift, acute pain related to burn injury. Check the lab work, administer an antiemetic, obtain the blood pressure, administer a sedative. Question 103. Which finding is associated with secondary syphilis? Painless, papular lesions on the perineum, fingers, and eyelids. Absence of lesions. Deep asymmetrical granulomatous lesions. Well-defined generalized lesions on the palms, soles, and perineum. Question 104. The nurse is caring for a client with Lyme's disease. The nurse should carefully monitor the client for signs of neurological complications, which include complaints of a drawing sensation and paralysis on one side of the face, presence of an unsteady gait, intention tremor, and facial weakness, complaints of excruciating facial pain brought on by talking, smiling, or eating, presence of fatigue when talking, dysphagia, and involuntary facial twitching. Question 105. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? Client with diabetes insipidus is receiving DAP, desmopressin acetate. Which lab finding indicates that the medication is having its intended effect? Encourage coughing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Rising blood pressure. Urinary output of 50 ml/hr. Rising blood pressure. Blood glucose 92 mg/dl. Urine specific gravity 1.020. White blood count of 7,500. Glycosylated hemoglobin 3.5 mg/dl. Urine specific gravity 1.020. Question 106. The nurse would identify which one of the following assessment findings as a normal response in a craniotomy client postoperatively. Decrease in responsiveness the third post-op day. Sluggish pupil reaction the first 24 to 48 hours. Dressing changes 3 to 4 times a day for the first 3 days. Temperature range of 98.8 degrees Fahrenheit to 99.6 degrees Fahrenheit the first 2 to 3 days. Question 107. The physician has ordered intubation and mechanical ventilation for a client with periods of apnea following a closed head injury. Arterial blood gases reveal a pH of 7.47, PCO2 of 28, and HCO3 of 23. These findings indicate that the client has respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Question 108. Which one of the following symptoms is common in the client with duodenal ulcers? Nurse is working in an endoscopy recovery area. Many of the clients are administered midazolam, versed, to provide conscious sedation. Which medication is important to have available as an antidote for versed? Epigastric pain following meals. Frequent bouts of diarrhea. Presence of blood in the stools. Diazepam, Valium, naloxone, Narcan, flumazenol, romazican, Florinef, fludrocortisone, flumazenol, romazican. Question 109. The nurse has just received the change of shift report. Which client should the nurse assess first? Client transferring to the neuro-rehabilitation unit. A client admitted with a suspected subdural hematoma. Question 110. The nurse caring for a client in shock recognizes that the glomerular filtration rate of the kidneys will fail if the client's mean arterial pressure falls below which of the following levels? 140, 120, 180. Question 111. The nurse is caring for a patient hospitalized with leukopenia. Which of the following assessments should be reported to the physician immediately? Client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication 3 times per day with meals. The temperature has increased from 98.6 degrees Fahrenheit to 99.8 degrees Fahrenheit. The respiratory rate is 24. O2 at 5L/min by nasal cannula Solumedrol 125 mg 4 push every 6 hours ceftriaxone, Rosfin, 1 gram IVPB daily Darvocet N 100 ppRN pain once per day in the morning 3 times per day with meals once per day at bedtime 4 times per day. Question 112. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the client hospitalized with MRSA is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? Client's pain. Nutritional status. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. The client should be placed in a room with negative pressure. Infection requires close contact, therefore, the door may remain open. Transmission is highly likely, so the client should wear a mask at all times. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Question 113. The nurse is caring for a client following a laryngectomy. The nurse can best help the client with communication by providing a pad and pencil, checking on him every 30 minutes, telling him to use the call light, teaching the client simple sign language. Question 114. The nurse is preparing a client for discharge following the removal of a cataract. The nurse should tell the client to take aspirin for discomfort, avoid bending over to put on his shoes, remove the eye shield before going to sleep, continue showering as usual. Question 115. Which of the following is not a step in primary assessment of a client presenting to the emergency department after being involved in a motor vehicle accident? Q. Obtaining vital signs. Using the Glasgow Coma Scale to check responsiveness. Controlling bleeding. Q. Contre-coup deceleration acceleration. Question 116. The nurse is assessing the heart sounds of a client with mitral stenosis following a history of rheumatic fever. To hear a mitral murmur, the nurse should place the stethoscope at. Client is admitted with symptoms of vertigo and syncope. Diagnostic tests indicate left subclavian artery obstruction. What additional findings would the nurse expect? The third intercostal space left of the sternum. Radial pulse differences over 10 bpm. The fourth intercostal space midclavicular line. Memory loss and disorientation, numbness in the face, mouth, and tongue, radial pulse differences over 10 bpm, frontal headache with associated nausea or emesis. Question 117. An elderly female is admitted with a fractured right femoral neck. Which clinical manifestation would the nurse expect to find? Client hospitalized with renal calculi complains of severe pain in the right flank. In addition to complaints of pain, the nurse can expect to see changes in the client's vital signs that include abduction of the right leg, increased blood pressure, shortening of the right leg, decreased pulse rate, increased blood pressure, decreased respiratory rate, increased temperature. Question 118. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? Roast beef sandwich, potato chips, pickle spear, iced tea, split pea soup, mashed potatoes, pudding, milk, tomato soup, cheese toast, gelatin, coffee, hamburger, baked beans, fruit cup, iced tea. Question 119. The physician has ordered Zyvox, linezolid, for a patient diagnosed with vancomycin-resistant enterococcus. Which food should be avoided? Wheat bread, honey, oranges, aged cheese. Question 120. The nurse is preparing a client for surgery. Which lab finding should be reported to the physician? Patient refuses to take his dose of oral medication. The nurse tells the patient that if he does not take the medication that she will administer it by injection. The nurse's comments can result in a charge of assault. Blood glucose 75 mg/dl. White cell count 8000 mm3. Malpractice, assault, negligence, battery. Question 121. The primary cause of anemia in a client with chronic renal failure is. Client with severe anemia is to receive a unit of packed red blood cells. In the event of a transfusion reaction, the first action by the nurse should be to stop the transfusion and maintain in 4 of normal saline. The course of combined therapy is usually 6 months. Insufficient erythropoietin. Medication is rarely needed after 2 weeks. He will need to take medication the rest of his life. The course of combined therapy is usually 6 months. Notify the physician and the nursing supervisor. Stop the transfusion and maintain in 4 of normal saline. Call the lab for verification of type and cross-match. Prepare an injection of Benadryl, diphenhydramine. Question 122. The nurse is caring for the client receiving amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? Changes in vision, nausea, urinary frequency, changes in skin color. Question 123. Nimodipine, Nimotop, is ordered for the client with a ruptured cerebral aneurysm. What does the nurse recognize as a desired effect of this drug? Burn client is in the acute phase of burn care. The nurse assesses jugular vein distension, edema, urine output of 20 ml in 2 hours, and crackles on auscultation. Which order would the nurse anticipate from the physician? Restore a normal blood pressure reading. Prevent the inflammatory process. Dissolve the clot that has formed. An antibiotic immune globulin and antiviral airborne isolation immune globulin furosemide, Lasix, 40 mg 4 push irrigate the Foley catheter increase the 4 fluids to 200 ml/hr place the client in Trendelenburg position furosemide, Lasix, 40 mg 4 push. Question 124. The nurse is caring for a client with a radium implant for the treatment of cervical cancer. While caring for the client with a radioactive implant, the nurse should provide emotional support by spending additional time with the client. Stand at the foot of the bed when talking to the client. Avoid handling items used by the client. Wear a badge to monitor the amount of time spent in the client's room. Question 125. The physician is preparing to remove a central line. The nurse should tell the client to. Nurse is caring for a client with a myocardial infarction. The nurse recognizes that the most common complication in the client following a myocardial infarction is cardiac dysrhythmia. Take a deep breath and hold it. Breathe as quickly as possible. Shake the inhaler and listen for the contents. Drop the inhaler in water to see if it floats. Check for a hissing sound as the inhaler is used. Press the inhaler and watch for the mist. Blood pressure 120/70, confusion, heart rate 120, crackles on chest, auscultation, mottled skin, lethargy, jaundice, urine output less than 30 ml in the past hour, heart rate 170, rapid shallow respirations, unconscious, petechiae, anterior chest, right ventricular hypertrophy, cardiac dysrhythmia, left ventricular hypertrophy, hyperkalemia. Question 126. Which of the following statements best explains the rationale for placing the client in Trendelenburg position during the insertion of a central line catheter? Client is admitted to the emergency department with complaints of crushing chest pain that radiates to the left jaw. After obtaining a stat electrocardiogram, the nurse should: it will make the client more comfortable during the insertion. Administer oxygen at 2 L per minute via nasal cannula. It will prevent the development of pulmonary embolus. Obtain a history of prior cardiac problems. Begin and for using a large bore catheter. Administer oxygen at 2 L per minute via nasal cannula. Perform pupil checks for size and reaction to light. Question 127. The nurse is caring for a client following a myocardial infarction. Which of the following enzymes are specific to cardiac damage? Wound culture results showing minimal bacteria. SGOT and CKBB, LDH and CKMB. LDH and CKBB. Wound culture results showing minimal bacteria, cloudy, foul-smelling urine, white blood cell count of 14,000/mm3, temperature elevation of 101 degrees Fahrenheit. Question 128. The home health nurse is visiting a client with an exacerbation of rheumatoid arthritis. To prevent deformities of the knee joints, the nurse should: tell the client to walk without bending the knees. Encourage movement within the limits of pain. Instruct the client to sit only in a recliner. Tell the client to remain in bed as long as the joints are painful. Question 129. The nurse is caring for a client with cancer of the pancreas. Which finding indicates involvement of the bile ducts? Dark urine, petechiae, dark stools, steatorrhea. Question 130. After attending a company picnic, several clients are admitted to the emergency room with E. coli food poisoning. The most likely source of infection is hamburger, hot dog, potato salad, baked beans. Question 131. The client has an order for sliding scale insulin at 1900 hours and Lantus, Glargine, insulin at the same hour. The nurse should: administer the two medications together. Administer the medications in 2 injections. Draw up the Lantus insulin and then the regular insulin and administer them together. Contact the doctor because these medications should not be given to the same client. Question 132. The nurse should carefully monitor the client for which common dysrhythmia that can occur during suctioning: polyuria, instilling eye drops, ventricular ectopic beats, sick sinus syndrome. Providing heat to the joints, instilling eye drops, administering pain medication, providing small, frequent meals, polyuria, hypertension, polyphagia, hyperkalemia. Question 133. The nurse is evaluating teaching effectiveness on a client with a gastrointestinal disorder, prescribed a gluten-free diet. Which diet choice indicates that the client understands the instructions given? Client with COPD is in respiratory failure. Which of the following results would be the most sensitive indicator that the client requires a mechanical ventilator? Blood pressure, pH 7.23, bran cereal. Deep tendon reflexes, blood pressure, urine output, tissue turgor, PCO 258, SAW 290, pH 7.23, HCO 330. Question 134. An elderly client with glaucoma has been prescribed Timoptic, timolol, eye drops. Timoptic should be used with caution in clients with a history of diabetes, gastric ulcers, emphysema, pancreatitis. Question 135. The nurse is caring for a client with suspected AIDS dementia complex. The first sign of dementia in the client with AIDS is: client has a tentative diagnosis of myasthenia gravis. The nurse recognizes that myasthenia gravis involves an interruption in the transmission of impulses from nerve endings to muscles, problems with speech, seizures. Close assessment for signs of bleeding is needed. The dosage of Coumadin is inadequate to prevent thrombi. The client should limit the intake of foods rich in vitamin K. Skipped doses should be made up by taking an additional dose. Loss of the myelin sheath in portions of the brain and spinal cord, an interruption in the transmission of impulses from nerve endings to muscles, progressive weakness and loss of sensation that begins in the lower extremities, loss of coordination and stiff cogwheel rigidity. Question 136. The nurse has just admitted a client with emphysema. Arterial blood gas results indicate hypoxia. Which physician prescription would the nurse implement for the best improvement in the client's hypoxia? Elevate the head of the bed 45 degrees. Encourage diaphragmatic breathing. Initiate an allupant nebulizer treatment. Start O2 at 2L/min. Question 137. Which vitamin should be administered with INH, isoniazid, in order to prevent possible nervous system side effects? Mefenide acetate, sulfamylin, niacin, pyridoxine, riboflavin. Mefenide acetate, sulfamylin, silver nitrate, providiniodine ointment, silver sulfadiazine, silvadine. Question 138. When administering total parenteral nutrition, the nurse should assess the client for signs of rebound hypoglycemia. The nurse knows that rebound hypoglycemia occurs when a complete blood count. The infusion is discontinued without tapering. The solution is infused through a peripheral line. The infusion is administered without a filter. An X-ray of the chest. Question 139. During morning assessments, the nurse finds that a client's nephrostomy tube has been clamped. The nurse's first action should be to assess the drainage bag, check for bladder distension, unclamp the tubing, irrigate the tubing. Question 140. The physician has ordered a thyroid scan to confirm the diagnosis of a goiter. Before the procedure, the nurse should assess the client for allergies to iodine, bolus the client with 4 fluid, administer an anxiolytic, insert a urinary catheter. Question 141. The nurse is instructing a patient scheduled for abdominal surgery on the use of a flow-metered incentive spirometer. Which instruction would the nurse include in the teaching plan? Blow on the mouthpiece of the device fast for 3 breaths, followed by slow for 3 more breaths. Use the incentive spirometer once every morning. Inhale slowly on the device to elevate and maintain the flow indicator. Briskly inhale on the device, making sure the flow indicator does not rise. Question 142. The client with a pacemaker should be taught to report ankle edema, check his blood pressure daily, refrain from using a microwave oven, monitor his pulse rate. Question 143. The nurse is assessing the client with a total knee replacement 2 hours post-operative. Which information requires notification of the doctor? Scant bleeding on the dressing, low-grade temperature, hemoglobin of 7 gm/dl, urine output of 120 ml during the last hour. Question 144. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? Client has had diarrhea for the past 3 days. Which acid/base imbalance would the nurse expect the client to have? Metabolic acidosis, preterm birth, but appropriate size for gestation, growth retardation in weight and length. Respiratory alkalosis, metabolic acidosis, metabolic alkalosis, respiratory acidosis. Question 145. The registered nurse is assigning staff for 4 clients on the 3 to 11 shift. Which client should be assigned to the LPN? Client with hyperthyroidism is taking escalith, lithium carbonate, to inhibit thyroid hormone release. Which complaint by the client should alert the nurse to a problem with the client's medication? The client complains of increased thirst and increased urination. A client with pneumonia expecting discharge in the morning. The client complains of increased thirst and increased urination. The client complains of increased weight gain over the past year. The client complains of rhinorrhea. Question 146. After several hospitalizations for respiratory ailments, a 6-month-old has been diagnosed as having HIV. The infant's respiratory ailments were most likely due to. Client has recently been diagnosed with primary open-angle glaucoma. The nurse should tell the client to avoid taking Benadryl, diphenhydramine, cryptosporidiosis, herpes simplex, Aleve, naproxen, Benadryl, diphenhydramine, Tylenol, acetaminophen, robitussin, guaifenesin. Question 147. The nurse is caring for a client with epilepsy who is being treated with carbamazepine, Tegretol. Which laboratory value might indicate a serious side effect of this drug? Client with sickle cell disease is admitted in active labor. Which nursing intervention would be most helpful in preventing a sickling crisis? Hemoglobin 13.0 gm/dl, WBC 4000/mm3. Administering 4 fluids at ordered rate of 200 ml/hr. Provide transcutaneous pacing. Turn the client on his side. Reassess the blood pressure. Consult with cardiology. Obtaining blood pressures every 2 hours. Administering pain medication every 3 hours as ordered. Monitoring arterial blood gas results. Administering 4 fluids at ordered rate of 200 ml/hr. Question 148. The intensive care unit is full and the emergency room just called in a report on a ventilator-dependent client who is being admitted to the medical surgical unit. It would be essential that the nurse have which piece of equipment at the client's bedside? Current jelly stools, intravenous controller, manual resuscitator, oxygen by nasal cannula. Current jelly stools, projectile vomiting ribbon-like stools, palpable mass over the flank. Question 149. The nurse is assessing the integumentary system of a dark-skinned individual. Which area would be the most likely to show a skin cancer lesion? Lower the head of the client's bed. Arms, face, palms. Lower the head of the client's bed. Initiate in 4 with a large bore needle. Notify the physician of the assessment results. Call for the cardiopulmonary resuscitation team. Question 150. The nurse is assessing elderly clients at a community center. Which of the following findings would be the most cause for concern? Client with hepatitis C who has cirrhosis changes has just returned from a liver biopsy. The nurse will place the client in which position? Loss of 1 inch of height in the last year. Stiffened joints. Rouse bilaterally on chest auscultation. Trendelenburg supine right side lying, left Sims right side lying. Question 151. When administering a tuberculin skin test, the nurse should insert the needle at a 15 degrees angle, 30 degrees angle, 45 degrees angle, 90 degrees angle. Question 152. The nurse is assessing the arterial blood gases, ABG, of a chest trauma client with the results of pH 7.35, P285, PCO255, and HCO327. What do these values indicate? Client with cancer and metastasis to the bone is admitted to the hospital. Which symptom of hypercalcemia causes the nurse the most concern? Uncompensated metabolic acidosis, compensated respiratory acidosis, cardiac changes. Weakness, anorexia, flaccid muscles, cardiac changes. Question 153. The physician has prescribed Quebec's cyanocobalamin for a client following a gastric resection. Which lab result indicates that the medication is having its intended effect? Initiating an intravenous infusion. Hemoglobin of 14.2 g/dl. Platelet count of 250,000 cu/mm. Eosinophil count of 200 cu/mm. Initiating an intravenous infusion, encouraging oral fluids, administering pain medication, straining the urine. Question 154. The nurse is performing a neurological assessment on a client admitted with TIAs. Assessment findings reveal an absence of the gag reflex. The nurse suspects injury to which of the following cranial nerves? 12. Hypoglossal. X. Vagus. 9. Glossopharyngeal. 7. Facial. Question 155. The nurse recognizes which of the following clients as having the highest risk for pulmonary complications after surgery. Nurse is observing a local softball game when one of the players is hit in the nose with a ball. The player's nose is visibly deformed and bleeding. The best way for the nurse to control the bleeding is to apply a wrapped ice compress to the nose. Tilt the head back and pinch the nostrils. Apply a wrapped ice compress to the nose. Pack the nose with soft, clean tissue. Tilt the head forward and pinch the nostrils. Question 156. The nurse is caring for a client with a diagnosis of hepatitis who is experiencing pruritus. Which would be the most appropriate nursing intervention? Suggest that the client take warm showers. Add baby oil to the client's bath water. Apply powder to the client's skin. Suggest a hot water rinse after bathing. Question 157. The elderly client is admitted to the emergency room. Which symptom is the client with a fractured hip most likely to exhibit? Pain, disalignment, cool extremity, absence of pedal pulses. Question 158. The physician has prescribed gantrezin, sulfasoxazole, 1 gm in divided doses for a client with a urinary tract infection. The nurse should administer the medication. Client with cancer received platelet infusions 24 hours ago. Which of the following assessment findings would indicate the most therapeutic effect from the transfusions? In more than one node or single organ on the same side of the diaphragm. 30 minutes after meals. Decrease in oozing of blood from foresight. In a single lymph node or single site in more than one node or single organ on the same side of the diaphragm in lymph nodes on both sides of the diaphragm in disseminated organs and tissues. Hemoglobin level increase from 8.9 to 10.6 mg/dl. Temperature reading of 99.4 degrees Fahrenheit. White blood cell count of 11,000/mm3. Decrease in oozing of blood from foresight. Question 159. The nurse is assessing a client following the removal of a pituitary tumor. The nurse notes that the urinary output has increased and that the urine is very dilute. The nurse should give priority to client is admitted with a diagnosis of pernicious anemia. Which of the following signs or symptoms would indicate that the client has been non-compliant with ordered B12 injections? Documenting the finding in the chart. Paresthesia of hands and feet. Raw fruits and vegetables. Calcium-rich foods, canned or frozen vegetables, processed meat, raw fruits and vegetables. Hyperactivity in the evening hours, weight gain, paresthesia of hands and feet, diarrhea, stools. Question 160. The MANTA test is used to determine whether a person has been exposed to tuberculosis. If the test is positive, the nurse will find a fluid-filled vesicle, sharply demarcated erythema, central area of induration, circular blanched area. Question 161. The nurse is preparing a client for cervical uterine radiation implant insertion, which will be included in the teaching plan. Client with multiple sclerosis has an order to receive Solamidrol 200 mg for push. The available dose is Solamidrol 250 mg per ml. How much medication will the nurse administer? 0.8 ml, 0.5 ml, 0.8 ml. 1.1 ml, 1.4 ml. Question 162. There is an order for a trough level to be drawn on the client receiving vancomycin, vancomycin. The nurse is aware that the lab should collect the blood. Increased blood pressure. Prior to the fourth infusion. 1 hour after the infusion. 2 hours before the second infusion. Increased blood pressure, decreased respirations, increased urinary output, decreased oxygen saturation. Question 163. Intraarterial chemotherapy primarily benefits the client by applying greater concentrations of medication directly to the malignant tumor. An additional benefit of intraarterial chemotherapy is Supervise the client's ambulation. Treatment of micrometastasis. Eradication of bone pain. Prevention of therapy-induced anemia. Supervise the client's ambulation. Measure the client's intake and output. Request a consult for speech therapy. Provide the client with a magic slate. Question 164. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid using which condiment? Mustard, salt, pepper, ketchup. Question 165. The nurse caring for a client with a suspected peptic ulcer recognizes which exam as the one most reliable in diagnosing the disease. Upper gastrointestinal X-ray, gastric analysis, endoscopy procedure, barium studies X-ray. Question 166. The physician has ordered a low-residue diet for a client with Crohn's disease. Which food is not permitted in a low-residue diet? Mashed potatoes, smooth peanut butter, fried fish, rice. Question 167. The physician has prescribed cyclogel, cyclopentolate hydrochloride, drops for a client following a scleral buckling. The nurse knows that the purpose of the medication is to positive blood, O negative blood, reduce the production of aqueous humor. O negative blood of negative blood. Question 168. The nurse is admitting a client with a suspected duodenal ulcer. The client will most likely report that his abdominal discomfort decreases when he, client with an esophageal tamponade develops symptoms of respiratory distress, including inspiratory stridor. The nurse should give priority to removing the tube after deflating the balloons. Eats a meal or snack. Whole grain cereal. Mashed potatoes, steamed carrots, baked fish, whole grain cereal. Applying oxygen at 4 via nasal cannula, removing the tube after deflating the balloons, elevating the head of the bed to 45 degrees, increasing the pressure in the esophageal balloon. Question 169. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Macaroni and cheese, shrimp with rice, turkey breast, spaghetti with meat sauce. Question 170. Which of the following findings would be expected in the infant with biliary atresia? Rapid weight gain and hepatomegaly, dark stools and poor weight gain, abdominal distension and poor weight gain, abdominal distension and rapid weight gain. Question 171. The nurse caring for a client with a closed head injury obtains an intracranial pressure, ICP, reading of 17 mmHg. The nurse recognizes that the ICP is elevated and the doctor should be notified. The ICP is normal, therefore, no further action is needed. The ICP is low and the client needs additional 4 fluids. The ICP reading is not as reliable as the Glasgow Coma Scale. Question 172. The nurse in the emergency room is caring for a client with multiple rib fractures and a pulmonary contusion. Assessment reveals a respiratory rate of 38, a heart rate of 136, and restlessness. Which associated assessment finding would require immediate intervention? Occasional small amounts of hemoptysis, midline trachea with wheezing on auscultation, subcutaneous air and absent breath sounds, pain when breathing deeply, with rowels in the upper lobes. Question 173. The nurse is caring for a client who is recovering from a fractured femur. Which diet selection would be best for this client? Client with AIDS complains of a weight loss of 20 pounds in the past month. Which diet is suggested for the client with AIDS? Dressed cheeseburger, French fries, and a Diet Coke. Tuna fish salad on sourdough bread, potato chips, and skim milk. High calorie, high protein, low fat. High calorie, high protein, high fat, high calorie, high carbohydrate, low protein, high calorie, low carbohydrate, high fat, high calorie, high protein, low fat. Question 174. The nurse is reviewing the lab reports of a client who is HIV positive. Which lab report provides information regarding the effectiveness of the client's medication regimen? Client with non-tropical SPRA has an exacerbation of symptoms. Which meal selection is responsible for the recurrence of the client's symptoms? Western blot. Cream of tomato soup and crackers. CD4 count. The medication can cause dental staining. The client will need to avoid a high-carbohydrate diet. The client will need a regularly scheduled blood work. The medication can cause problems with drowsiness. Tossed salad with oil and vinegar dressing, baked potato with sour cream and chives, cream of tomato soup and crackers, mixed fruit and yogurt. Question 175. The physician has ordered injections of Nemega, Overthinking, for a client receiving chemotherapy for prostate cancer. Which finding suggests that the medication is having its desired effect? HCT 12.8 platelets 250,000 mm3, neutrophils 4,000 mm3, RBC 4.7 million. Question 176. The mother of a child with cystic fibrosis tells the nurse that her child makes snoring sounds when breathing. The nurse is aware that many children with cystic fibrosis have an air leak in the system, nasal polyps, septal deviations, decrease in level of consciousness, widening pulse pressure, decrease in the pulse rate, dilated, fixed pupils, decrease in level of consciousness, and air leak in the system, the suction being too high, the suction being too low. Question 177. The physician has ordered an infusion of osmitrol, mannitol, for a client with increased intracranial pressure. Which finding indicates the direct effectiveness of the drug? Client with osteoarthritis has a prescription for Celebrex, Celecoxib. Which instruction should be included in the discharge teaching? Report chest pain to the physician. Decreased diastolic blood pressure. Increased pupil size. Take the medication with milk. Report chest pain to the physician. Remain upright 30 minutes after taking the medication. Allow 6 weeks for optimal effects. Question 178. The nurse is formulating a plan of care for a client with a goiter. The priority nursing diagnosis for the client with a goiter is body image disturbance related to enlargement of the neck, activity intolerance related to fatigue, nutrition imbalance, less than body requirements, related to increased metabolism, risk for ineffective airway clearance related to pressure of goiter on the trachea. Question 179. The nurse is evaluating cerebral perfusion outcomes for a client with a subdural hematoma. The nurse evaluates which of the following as a favorable outcome for this client? Arterial blood gas PA2 of 98. Increase in lethargy. Pupils slow to react to light. Temperature of 101 degrees Fahrenheit. Question 180. The nurse is providing dietary instructions for a client with iron deficiency anemia. Which food is a poor source of iron? Tomatoes, legumes, dried fruits, nuts. Question 181. The nurse is making assignments for the day. The staff consists of an RN, a novice RN, an LPN, and a nursing assistant. Which client should be assigned to the RN? D5W at 200 ml/HR. A client with an esophageal tamponade. D5W at 200 ml/HR. Dimeclocycline, declamycin, 150 mg Q6H. Daily weights. Monitor intake and output. Question 182. The nurse is caring for a client after a motor vehicle accident. The client has a fractured tibia, and bone is noted protruding through the skin. Which action is of priority? Client is discharged home with a prescription for Coumadin, sodium warfarin. The client should be instructed to cover the bone area with a sterile dressing. Apply an ACE bandage around the entire lower limb. Place the client in the prone position. Avoid antihistamines containing diphenhydramine. Increase the intake of all vegetables. Have a PTT checked monthly. Have a CBC drawn every 6 months. Avoid antihistamines containing diphenhydramine. Question 183. The nurse is performing discharge teaching for a client after a cardiac catheterization. Which statement by the client indicates a need for further teaching? I should not bend, strain, or lift heavy objects for 1 day. If bleeding occurs, I should place an ice bag on the site for 10 minutes. I need to call the doctor if my temperature goes above 101 degrees Fahrenheit. I should talk to the doctor to find out when I can go back to work. Question 184. The nurse is preparing to discharge a client following a laparoscopic cholecystectomy. The nurse should tell the client to avoid a tub bath for 48 hours. Tell the client to expect clay-colored stools. Tell the client that she can expect lower abdominal pain for the next week. Tell the client to report pain in the back or shoulders. Question 185. Which finding is the best indication that a client with ineffective airway clearance needs suctioning? Client taking antiretroviral drugs reports his last blood work showed a drop of 3 units in the viral load. The nurse understands that respiratory rate, breath sounds, 99% of the viral load has been eliminated. The virus is no longer detectable. 90% of the viral load has been eliminated. 95% of the viral load has been eliminated. 99% of the viral load has been eliminated. Question 186. Which of the following nursing interventions has the highest priority for the client scheduled for an intravenous pyelogram? Providing the client with a favorite meal for dinner. Asking if the client has allergies to shellfish. Encouraging fluids the evening before the test. Telling the client what to expect during the test. Question 187. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin, Crestor. Which instruction should be given to the client taking rosuvastatin, Crestor? Client hospitalized for treatment of congestive heart failure is to be discharged with a prescription for Digitec, digoxin, 0.25 mg daily. Which of the following statements indicates that the client needs further teaching? I can prevent stomach upset by taking the medication with an antacid. Take the medication with fruit juice. Report difficulty sleeping. I will need to take the medication at the same time each day. I can prevent stomach upset by taking the medication with an antacid. I can help prevent drug toxicity by eating foods containing fiber. I will need to report visual changes to my doctor. Question 188. The physician has ordered an MRI as a part of the client's diagnostic workup. An MRI should not be done if the client has permanent pacemaker, sensory deafness, a permanent pacemaker. Question 189. The nurse is caring for a client with rheumatoid arthritis. The nurse knows that the client's early morning symptoms will be most improved by taking a warm shower upon awakening, applying ice packs to the joints, taking 2 aspirin before going to bed, going for an early morning walk. Question 190. The nurse is performing a physical assessment on a newly admitted client. The last step in the physical assessment is inspection, auscultation, percussion, palpation. Question 191. The physician orders the removal of an indwelling catheter the second post-operative day for a client with a prostatectomy. The client complains of pain and dribbling of urine the first time he voids. The nurse should tell the client that using warm compresses over the bladder will lessen the discomfort. Perineal exercises will be started in a few days to help relieve his symptoms. If the symptoms don't improve, the catheter will have to be reinserted. His complaints are common and will improve over the next few days. Question 192. The glycosylated hemoglobin of a 40-year-old client with diabetes mellitus is 2.5%. The nurse understands that student nurse is observing a neurological nurse perform an assessment. When the nurse asks the client to stick out his tongue, the nurse is assessing the function of which cranial nerve. The client has good control of her diabetes. The client requires adjustment in her insulin dose. 12 hypoglossal. 2 optic eye olfactory X vagus 12 hypoglossal. Question 193. The nurse is reviewing the lab results of a client's arterial blood gases. The PACO2 indicates effective functioning of the client with AC3 spinal cord injury experiences autonomic hyperreflexia. After placing the client in high Fowler's position, the nurse's next action should be to make sure the catheter is patent. Lungs, liver. Notify the physician, make sure the catheter is patent, administer an antihypertensive, provide supplemental oxygen. Question 194. For clients are admitted to a medical unit, if only one private room is available, it should be assigned to the client with ulcerative colitis, the client with neutropenia, the client with cholecystitis, the client with polycythemia vera. Question 195. Which diet is associated with an increased risk of colorectal cancer? Low protein, complex carbohydrates. High protein, simple carbohydrates. High fat, refined carbohydrates. Low carbohydrates, complex proteins. Question 196. Hyperstat, diazoxide, is ordered for a patient with hypertension. Which side effect is associated with the medication? Photophobia, numbness of the hands, urinary frequency, alopecia. Question 197. The nurse is reviewing the lab reports on several clients. Which one should be reported to the physician immediately? White cell count of 200 cu/mm in a client taking dilantin, phenytoin. A white cell count of 200 cu/mm in a client taking dilantin, phenytoin. Question 198. The nurse has performed nutritional teaching on a client with gout who is placed on a low purine diet. Which selection by the client would indicate that teaching has been ineffective? Boiled cabbage, apple, peach cobbler, spinach. Question 199. The nurse is caring for a client in the acute care unit. Initial laboratory values reveal serum sodium of 156 milliequivalent/L. What behavior changes would the nurse expect the client to exhibit? Hyperreflexia, manic behavior, depression, muscle cramps. Question 200. The physician has diagnosed a client with cirrhosis characterized by asterixis. If the nurse assesses the client with asterixis, he can expect to find irregular movement of the wrist, enlargement of the breasts, dilated veins around the umbilicus, redness of the palmar surfaces. Question 201. The client with color blindness will have problems distinguishing which of the following colors: orange, violet, red, yellow. Question 202. The nurse is caring for a client post-op femoral popliteal bypass graft. Which post-operative assessment finding would require immediate physician notification? Loss of posterior tibial and dorsalis pedis pulses. Serous drainage noted at the surgical area. A loss of posterior tibial and dorsalis pedis pulses. Question 203. The nurse is caring for a client with osteoporosis who is being discharged on alendronate, Fosamax. Which statement would indicate a need for further teaching? I should take the medication immediately before bedtime every night. I should remain in an upright position for 30 minutes after taking Fosamax. The medication should be taken by mouth with water. I should not have any food with this medication. Question 204. The nurse is caring for an older client hospitalized with dehydration. Which site should be used to check for skin turgor? Hand, arm, abdomen, forehead. Question 205. In order to reduce the risk of hypotension and red men syndrome, infusions of vancomycin, vancomycin, should be administered within 15 minutes, only after giving Benadryl, diphenhydramine, over 1 hour, with Zantac, ranitidine, or other histamine. Question 206. The nurse is caring for a client with epilepsy who is to receive phenytoin sodium, dilantin, 100 mg for push. The client has N4 of D51/2NS infusing at 100 ml/HR. When administering the dilantin, which is the appropriate initial nursing action? Client weighing 150 pounds has received burns over 50% of his body at 1,200 hours. Using the Parkland formula, calculate the expected amount of fluid that the client should receive by 2,000 hours. 6,800. Flush the 4-line with normal saline. Remedicate with promethazine, Phenergan, 4 push. Lactate Ringer's dextrose 1% in water 3% normal saline dextrose 5%/0.45% normal saline strain his urine increase his fluid intake report urinary frequency avoid prolonged sitting 3,400 6,800 10,200 13,600. Question 207. The nurse is developing a plan of care for a client with a newly created ileostomy. The priority nursing diagnosis for this client is risk for deficient fluid volume related to excessive fluid loss from ostomy, disturbed body image related to presence of ostomy, risk for impaired skin integrity related to irritation from ostomy appliance, deficient knowledge of ostomy care related to unfamiliarity with information resources. Question 208. Which person is at greatest risk for developing Lyme's disease? Client with increased intracranial pressure is placed on mechanical ventilation with hyperventilation. The nurse knows that the purpose of the hyperventilation is to decrease cerebral blood flow. Veterinarian. Landscaper. Prevent the development of acute respiratory failure, decrease cerebral blood flow, increase systemic tissue perfusion, prevent cerebral anoxia. Question 209. The first action that the nurse should take if she finds the client has an O2 saturation of 68% is elevate the head of the bed. Recheck the O2 saturation in 30 minutes. Apply oxygen by mask. Assess the heart rate. Question 210. The nurse has given instructions on pursed lip breathing to a client with COPD. Which statement by the client would indicate effective teaching? I should inhale through my mouth very deeply. I should tighten my abdominal muscles with inhalation. I should contract my abdominal muscles with exhalation. I should make inhalation twice as long as exhalation. Question 211. Which action by the healthcare worker indicates a need for further teaching? Patient with pulmonary tuberculosis is receiving combination therapy. To increase the effects of the medication, the patient may be given. The nurse wears goggles while performing a venipuncture. Benamid, probenecid. The nurse wears gloves to monitor the 4 infusion rate. Inderal, propranolol, dilantin, phenytoin, Benamid, probenecid, Nerol, cyclosporin. Question 212. Which aminophylline level is associated with signs of toxicity? 5 micrograms/ml, 10 micrograms/ml, 20 micrograms/ml, 25 micrograms/ml. Question 213. The nurse is completing an assessment history of a client with pernicious anemia. Which complaint differentiates pernicious anemia from other types of anemia? Faster than usual heart rate, numbness and tingling in the extremities, feelings of lightheadedness. Question 214. When caring for a client with an anterior cervical discectomy, the nurse should give priority to assessing for postoperative bleeding. The nurse should pay particular attention to drainage on the surgical dressing, complaints of neck pain, bleeding from the mouth, swelling in the posterior neck. Question 215. The nurse is preparing to administer oral potassium chloride to an elderly client. Which action should the nurse take before administering the medication? Client with inflammatory bowel disease, IBD, requires an ileostomy. The nurse would instruct the client to do which of the following measures as an essential part of caring for the stoma. Assess for signs of hypocalcemia. Withhold food for 30 minutes. Cleanse the peristomal skin meticulously. Gastric distress, changes in hearing, red discoloration of body fluids, changes in color, vision. Perform massage of the stoma 3 times a day. Include high-fiber foods in the diet, especially nuts. Limit fluid intake to prevent loose stools. Cleanse the peristomal skin meticulously.